I'm Joseph Niland. I'm a fellowship-trained hip and knee arthroplasty surgeon at Southern Joint Replacement Institute in Nashville, Tennessee. I grew up just outside San Antonio in the Texas Hill Country on a small ranch. So what first inspired me to pursue a career in medicine was some encounters that I had in high school. I was an athlete in high school. I ran cross country and track. I played football. I eventually went to the University of Texas, where I ran varsity cross country and track there. But along the way, I had multiple injuries and I had to encounter multiple types of physicians. One of the physicians that had the most impact on me was an orthopedic surgeon from the San Antonio area. He was a kind, dedicated, passionate orthopedic surgeon who, as soon as he saw that I had a little bit of interest in science and anatomy, kind of latched on, offered me mentoring experiences I got to shadow, and really kind of fostered that initial curiosity I had. I did my undergraduate university studies at the University of Texas at Austin. I followed that up by going to the University of Texas Health Science Center at Houston for my medical school as well as my residency. It was an outstanding educational experience. I was able to train at the busiest trauma center in the country and at times in the world, which just provided a breadth of experience that I thought was invaluable. After that, I matriculated to Southern Joint Replacement Institute here in Nashville for my fellowship training to specialize in hip and knee arthroplasty. One of the patient encounters that really reaffirmed that I was doing what I was meant to do was I had a patient that came to me. She hadn't walked in about 4 months from severe hip pain, and a simple x-ray demonstrated that she had severe arthritis that was causing this. So I was able to do a hip replacement, and then she got up, and that first time that she walked into clinic after surgery with just a cane was an amazing feeling. She was able to go to her grandson's wedding, dance with them, and it was just an experience that you can't describe until I had it myself, but definitely reaffirmed that I was doing what I was meant to do. I think language is really important in medical settings. I think not only does it help you to convey information, but it also helps to put patients at ease and establish a connection with them. I grew up in Central Texas. I am Hispanic. I have a strong connection to the Hispanic community. And I've had family members that have driven multiple hours to a physician that made them feel comfortable because they could speak in their own language. So I think it's extremely powerful when you're able to offer that service to help those patients through their medical journey. Bienvenidos a mis pacientes que hablan español. Yo soy Dr. Joseph Niland, un ortopédico para Southern Joint Replacement Institute.